include understanding the structures that are used for respiration, beginning from the mouth. This is assuming that this is someone's mouth. Beginning from the mouth, the pharynx or pharynx, and then you now have the epiglottis here, which would usher in air into the larynx, and then you now have the trachea, which will continue that process, and then you have a bifurcation, the angle of Louis, and in the right side, it will be 3 bronchos that you expect to have. Either way, they will form 3 lobes collectively inside the mediastinum. Inside the pleural membrane, And then the same thing will occur for the upper part as well, where you have for the left part, but in the left part, you're only going to have 2 lobes. I don't know if that makes sense. In the lungs, in the left part. Make sense? And that's because of the mediastinum, right? The mediastinum occupies a huge chunk of the lungs on the left side, not true?
Yeah.
Now, the important thing to note is that the anatomy, the physiology is an important dynamics, right? But in this aspect, we want to talk about a specific aspect of the lung function and the mechanism of the. By the way, this lung, like I said, the balloons called lobes expanded by the negation, the pleural membrane that to the chest wall, right? So let's play this bit and put the chest wall here. Shall we do that? This chest wall here, like so. Okay. Now, don't forget, basically, I want us to focus on just one area. That area would be the pressure. The pressures of the lungs. Now, it's important to start from the volume before you talk about pressure, but we'll just skip to this and then I would show you these areas just now. The pressures of the volume, naturally, you're supposed to start understanding the whole concept from the area of the volume. That's where it starts from. But let's just do this because I would give you a recap of the areas that are important. Now, for the pressure of the lungs, for the love of simplicity, we would want to remember that there are 3 types. Before I jump into what's going on, there are 3 types. First, you have intrapleural pressure. Let me start with pulmonary pressure. And this is the first one. The second one is transmural pressure. And then the third one is intra. Remember what intra implies, right? That it is within, right? So intrapleural. Intrapleural pressure. These are all pressures across within the lungs. If you have any confusion, please feel free to interrupt and ask me to clarify. Understood? All of these pressures for you. That brings in the air and the air. So pressure can be used to push. Understood? Pressure could be used to push or pull. Interesting. Now, what does that mean? Good. If you have, let's say, a positive pressure, you generate a positive pressure by either pressing on something or pushing on something, and then between your hand and the object you're pushing will be a positive pressure. That would compel that object to move at some point. And you can generate a positive pressure too if you're working with gases. You can generate that positive pressure by compressing the gas. If you compress the gas, they would begin to store the potential energy of push in them, so that if you open up a hole in a balloon, all the air will come out because they have been pushed out of it by the positive pressure that is created. So the positive pressure pushes things away, and if it's a molecule, it makes them to expand. Once the pressure is relieved or released, it pushes. All right. So we could create a positive pressure in the lungs by collapsing our chest wall so that the lung pressure will increase, and it has an interaction with volume. I'll come back to that law. And then once the pressure increases, it pushes the air out as a result. But then how are you able to do the opposite? You do that by creating a negative pressure. So negative pressures are sucking pressure, basically. And or pulling pressure. These are the to describe it. I don't know if this makes sense to you. When the pressure is at zero, like zero, which means in between positive and negative is zero, it means that there is no net push or pull. There is no net movement of gases as well, because the pressure is zero. The net pressure is zero. So, and this answered, we will be able to, process what all these things mean. So now coming back to this before I jump into the lung volume, what is the intrapulmonary pressure? The intrapulmonary pressure is otherwise called the alveolar pressure. Or should I add the intra to it? Yes, indeed. So the intrapulmonary pressure is the same as the intrathoracic pressure. Then the transmural pressure is the same as transpulmonary pulmonary pressure. Okay, so now the intra-alveolar pressure will be the pressure inside the alveolum. If we go back to this picture, and we are able to extend this until it branches into very small ischiums, or very small sacs or alveolums, then what you will have is the fact that the pressure here, right, would be pressure inside this little sacs would translate to the intra-alveolar pressure. That pressure can be, because this area is directly connected to the atmosphere. If you look at it, it means that the alveoli would either be 1 or 2 units from the atmosphere. So if you have an alveolar pressure that's slightly higher than the atmosphere to push air out. If it is slightly lower, then it means that the air difference will be created. Air pressure difference will be created between the atmospheric air and the lungs, and the air will come in. So what that means is that the alveolar pressure is either negative or positive. Okay, what does that mean? Now, when the pressure is negative, what that means is that if the atmospheric pressure, the pressure outside, usually the atmospheric pressure would be 760 millimeter mercury or 1 atm. This is for close to sea level. Anything less than 10 meters above sea level should probably slightly be higher. So anything close to sea level will have this pressure. This is the pressure. So if you have 759, that pressure is less than atmospheric pressure, and because of this, there will be a pressure difference between this 1 and 2. Therefore, air would move from the outside of the lungs to the inside of the lungs. So all the lungs has to do is decrease the pressure in the lungs by just 1 unit, and air would glide from outside into the alveolar, and that is very useful, right? That helps for ventilation. Good. So when the air is when the atmospheric, the difference in the pressure is 0, what it means is that P1 minus P2 is equal to 0. What does that mean? What it means is that the alveolar pressure, which is going to be P2, is the same as the atmospheric pressure. Therefore, the difference will be 0. And in that instance, there is no movement of air at all out. I'll jump to how this affects inspiration. So if the pressure in the lung drops to 759, then the difference will be 1. The difference will be 1. Hold on. So this will be, the difference is 1, but it's a positive 1 here. This positive 1 is the pushing air, so I would have to reverse this. to make it make sense or be consistent. So you're checking the pressure in the lungs, P2, and it's the pressure outside the lungs, P1. When it's 0, the two are the same. But when P2 is 759, 1 unit short of the atmospheric pressure, what would you see? What you would see is, so the value will be what? -1. And this is to indicate that the pressure in the lungs. Now, what will, right? Difference in these would be, now there is a positive pressure in the lungs. This would be the outcome of respiration, the expiratory activities of the muscles and collapse of the chest wall, and that will lead to the expulsion of fluid. Beautiful. So inspiration occurs when the pressure is negative. When the pressure is negative, the pressure in the alveoli is negative, and expiration occurs when the pressure you have 0. Alright, in between pressure and expiration you have 0. The graphs will be a graph that we plot. It's a pressure. You have, if I can do this right, you have the pressure, and that pressure can be plotted against time. So if we have, let me put it in order here. So if you have, let's say for example, you have, right, so we have increase. Before now we just use a +1 and -1. They say this is 0, and then plus will be towards this direction up, and negative will be towards this direction -1. During inspiration, you have the air coming into the lungs. All right. For the air to come into the lungs, what happens? We say that the pressure in the alveoli must fall within negative, right? Must be negative. Okay, so let's work that out. The moment you start breathing, your diaphragm drops, and then the chest wall begin to rise. So when the chest wall rises, but something happens. Oh gosh, that is low. I will have to bring this real quick. Voice law is an important lesson I'm about to say. What is the relationship between pressure? Right, that's important. I will send you the video so you're able to capture anyone that you miss. So Boyle's law gives us the relationship between pressure and volume. Now, what Boyle's law states is that there's an indirect relationship between pressure and volume. When the pressure is increasing for a fixed mass of substance, the volume will definitely have to decrease to compensate for that. And when the pressure for a fixed amount of material, when the pressure is increasing, volume will have to when pressure is decreasing, the volume will have to increase to compensate for that. So you just have to remember this. So let's say you have a volume, a fixed mass of volume, let's say cylinder, and you begin to press on the sides and reduce the volume. Or let's say there's a piston, and you push on that piston and you reduce the volume. What will happen to the pressure inside? When you reduce the volume to somewhere here, the pressure will definitely increase. This is the piston. All right. So if you do this, pressure will definitely increase. And guess what's happening? But if you pull it up somewhere here, to expand, and it will be compensated by a corresponding reduction in pressure. At some point, the pressure might become negative and begin to pull. So let's go back to this stuff. Now I'm going to put it in a graphical form because when it might be a little bit complicated, but that's when it's more visually presentable or visually accessible, because you can see what is happening and tell what's going on, especially when you want to compare two different patients. So first, the diaphragm drops, and when the diaphragm drops, what you're having is the volume has increased, and the volume, a fixed volume, has been expanded. Put it that way. and there's no air coming in that moment. So when it drops, what happens now is that the pressure, it comes to compensate for that increase in volume. The pressure has to drop. So it means that at the onset of inspiration, just the moment when the diaphragm drops on the chest, just before I start inhaling, because I realized I started inhaling and then I was going down. So if my diaphragm now is that it goes to negative immediately, because the pressure is that the pressure